Got Charles Moak with, if your testosterone is low, you're going to get fat and 17 other things the FDA doesn't want you to know about treating low T. And the FDA regulates the manufacture and sales, marketing of drugs, but they don't regulate the practice of medicine. And the FDA has placed testosterone in kind of a unique class. In the 1950s, about 1952, the FDA approved testosterone replacement for men who are missing their testicles or had damage to their testicles, or who had damage to their brain, the brain chemical that signals the testicles to make testosterone, or they had extra female chromosome, so they had female-like features and they couldn't make testosterone. Those are the three indications in the 50s, over 60 years ago. And then in about 2000, say 1990 to 2000, we started realizing that there were a lot of men who had their testicles intact and who had their brain intact and didn't have extra female chromosome that were having symptoms of low testosterone, and they would benefit from testosterone replacement. And prescriptions for testosterone replacement went up dramatically. The drug company started out with the low T commercials. You might have seen that. If you have low T, you don't see them anymore because the FDA sued them to stop. And what the FDA said was that in 1950, when we approved this, we approved it for men that were missing their testicles, that had brain damage, or that had an extra female chromosome. And they specifically said in their guidelines in 2013, they reinforced it in 14 and 15, they said basically, despite all the evidence, they said that if your testosterone is low for no reason other than aging, even if your symptoms seem to be clearly correlated to low testosterone, it's not approved. It's just not approved. We declared in 1950 it's only approved for men missing their testicles, brain damage, or an extra female chromosome. And this is something that's kind of spooked a lot of doctors. Like, they're like, well, the FDA is telling us not to use it. No, they're actually telling pharmacies, or they're actually telling pharmaceutical manufacturers not to market it to men, so that way they were able to sue the drug companies for marketing it to men. They would regulate manufacturing, but they don't regulate the practice of medicine. But a lot of doctors have been kind of like a little bit spooked because it's like the FDA says you're not supposed to use this for men. Well, we know that testosterone replacement in men with low testosterone cuts a man's risk of dying in half. Okay, so as physicians, as patients, we got to take control of our own health. We don't want a government body telling us what to do based on rules they made in 1950 before the science was out.